Hello, my name is Dr. Avi Shah, Consultant Pediatric Orthopaedic Surgeon at SRCC Children's Hospital managed by Narayana Health. For children, physical play is as good as breathing. As soon as they start standing, they are fighting imaginary foes and winning races against imaginary friends. It is a common scenario in most households that your child comes home after playing from practice or from the playground and is complaining of an injury near their foot and ankle. As a parent, you get really worried and want to know, is it a strain, is it a sprain, or worse even, is it something that is broken? Playing sports such as basketball and football, or even playing in the park, or even jumping off from a swing or running around can lead to injuries in children. So as a parent, how would you differentiate between a strain, sprain, or that if something is broken? There are 26 bones in your child's foot and almost 19 major joints. We all know that your child's foot is growing, even their ligaments and muscles are maturing as they grow. The commonest injuries that we see in children are broken bones or growth plate injuries. It is very common for your child to break their bone, but in children, as we know, they have growth plates or certain cartilaginous tissues which lead to the growth of their bone. These are more prone to injuries in your growing children. Ligaments are structures that hold our joints together. Injuries to these ligaments are known as sprains. Overstretched or torn muscles are known as strains. These are more common in children who play high-level sports or are really active. This can happen if they overuse or overexert certain joints too much while doing their sporting activities. So unless you know the anatomy of the foot and ankle, it is very difficult to differentiate between a strain, a sprain, and a broken bone. So as a parent, it is more important not to know what your child has, but it is pertinent to know when should you really seek help from a specialist, or if at all does your child really need help. If there is significant swelling, if there is misalignment of the foot or ankle, if there is discoloration of the skin, that is your child's foot is turning blue, if they are not able to move their ankle or their foot, they are not able to put weight on that leg, if there is numbness or there is bleeding or there is a break in the skin, then these are signs of grievous injuries to the foot and ankle, and it is pertinent that your child be seen by a specialist to make sure they get the right treatment. Once your child is brought into the hospital, at times they will need an X-ray or sometimes higher imaging. Your child may need a cast, a brace, or a boot for treatment, and if the injury is really serious, they sometimes may need even surgery. When your child is not having a severe pain, is able to move their ankle or foot, and there is no severe misalignment of the foot or ankle, then these injuries may not be severe and it is no reason to rush in the middle of the night to the hospital. All parents need to know the right way of first aid treatment for their child. The easiest and the safest method is the RICE method. R is rest. Rest, as you know what rest is, your child needs rest and should not be moving their foot and ankle if it is injured. I for ice pack. Apply ice pack or cold compress in a covered cloth for at least 20 minutes and repeat this for at least 4 to 5 times in the whole day. C for compression. You can give your child a compression bandage or a crepe bandage to temporarily give relief from the swelling which is present during the injury. E for elevation. You should elevate your child's limb above the level of their heart to help reduce the swelling which is present. At all costs, avoid any massage with oils or any solutions because this can cause more harm to your child's foot and ankle. If at all your child's symptom worsen, please make sure you urgently bring them to a specialist to have them checked. So it is very important that your child has the right physical conditioning. They warm up before doing any activities. They take rest after activities. They are well hydrated. They eat well. And it is very important that they have the right footwear. We at SRCC Children's Hospital, managed by Narayana Health, have a great team to help your child and provide them with specialist care for such injuries. We have a wonderful team of nurses and doctors who are available here all the time and who are specialized in treating such injuries for your beloved child. We are here to make you and your child comfortable during this entire experience. Thank you.